see. Actually, I've come here to share the knowledge about dengue with you. So I think everybody of you know everything. Actually, what I want to show here, not real study, actually some constellation of studies. Because I am from Bangladesh, population are very high. I have seen many thousands of dengue fever in my country. At the beginning of the century, around 2000, there are so many cases of dengue fever. I personally faced, many of my colleagues faced, patients, attendants, other, and whole country reacted with a great panic really. And everybody was afraid of that time. And as a beginner of treating dengue, because at that time I had also not much experience. So I've seen a lot of people, so I got the experience at that time really. And I faced many problems regarding the management, regarding the diagnosis, prevention, other. And on that basis, actually I prepared this lecture just to tell you about my practical experience while I have managed or they are managing dengue fever. Just next slide please. Now, what I want to say, misconception is misinterpretation in dengue fever. What I mean, actually, there are a lot of doctors, patients, attendants, everybody. I think there are some misconceptions about dengue fever and also misinterpretation by many. On that basis, these are the points where I think every physician, everyone must know about them. These are the fatality of dengue fever, fever in the critical period, atypical presentations, concomitant surgery or any surgical interference, investigations, and treatment. I'll just briefly, I'll try to discuss about this where we can make a mistake. Next slide, please. Now, fatality of dengue fever. Today's version is dengue fever, let's stop it. So I think why you want to stop it? Because everybody is afraid. So that is the reason you want to stop it. My question is it a dangerous disease? What I feel at present, at the year 2014, it is not at all. Because really it was dangerous around 2000 or before that. There is nothing to be apprehensive about the fatality of the disease. Because of the misconceptions about the severity of the disease, till today, many people, including many doctors, are very worried as if this is a death penalty. Mortality rate, it was before this time, before 2000, it varies from country to country, it was like that. But at present, I think mortality is very less. Even if treated properly, diagnosed early, treated properly, I think it should come to zero mortality. So I do not feel it's a dangerous disease. Next slide, please. Now another point, fever and the critical period, there are many misconceptions among the doctors, also the patients, their attendants like that. Now you know, or many of you know, fever usually persists for 5 to 6 days. It's followed by complete remission. In some cases, there may be recurrence of fever. We call it biphasic or saddleback. However, with remission of fever, a real problem may occur, which is called the critical period. I want to give more emphasis here. Reason is, as the fever subsides after 5 days, the patient may feel, I'm fine. Or even the doctor may think, if he is not aware, there is nothing to be worried. So patient, fever has gone, so he will sit in the house idle. Doctors may think it is all right, so nothing to be done. But really, everyone must take care during this period. Next slide, please. Now, during this period, actually platelet count starts to fall. Maybe very low, especially in DHA, dengue hemorrhagic fever. Many complications, especially hemorrhage from different sizes, hematopoiesis, myelin, etc. may occur. Even DSS, dengue shock syndrome. So the patient and every physician must be cautious. After 5 or 4 days, all the problems may occur, may or may not occur. But if you are not cautious, real catastrophe may occur. Next slide, please. Now, there is another point also, atypical presentation. I have seen during my practice in dengue fever, usually there are many spectrum of presentation we have seen in the previous speakers' lectures. In many patients, typical features of dengue fever may not be present, like fever, skin rash, other, nothing. You may not get anything. Next slide, please. In some case, fever is followed by, I have seen cases, fever and then only hematosis or melena or bleeding from other side. And physician, if he is not aware about the diagnosis, he can make a mistake. Hematosis, he might think peptical cell bleeding. Melena, same thing, bleeding from GIT or other. But actually that is the case. Dengue fever, that may be the only presentation, that may not be any other thing. So if you are not careful, you can miss the diagnosis. In female patient I have seen, just nothing. Fever just started period earlier during the scheduled time, before the real time. Or if he is on already menstruating, there will be persistent bleeding. Again, if any physician is not careful, he will miss the diagnosis. Because he or she will think there is something related to gynecological problem. So there may be mistake also. Acute abdomen, there may be confusion with acute appendicitis, pancreatitis, acute evolution of chronic disease like that. And also again, there may be mistake or miss the diagnosis. I've seen cases also, you already giving syndrome renal failure. You know, there is in the first lecture, there is one thing in classification that is called expanded dengue syndrome. And this thing may happen in case of any dengue fever. Next slide, please. Now CNS, these are also atypical presentation. I have seen cases, patient may present with only convulsion, CVT, subdural hematoma, peripheral neuropathy, mononeuropathy, desmogletis, quadriparesis, maculopathy, isolated cranial palsy, encephalopathy, or encephalitis, aspirin. These are the features actually. These are rare. And dengue itself may cause this, and this may be an important cause, especially during epidemic or when there is outbreak or when there is endemic zone. You must be careful, otherwise doctor can miss the diagnosis. Next slide, please. We have seen cases, viral hepatitis. Many patients used to come before also, just come with jaundice. But actually these are many cases where due to dengue fever. This thing may happen. DIC, acute respiratory syndrome. Dengue fever may present with any of the above conditions. And if anyone is not careful, there is every chance of missing DF. Now in endemic zone, anyway, yes, okay. Now clue to the diagnosis, okay.
Sorry.
No problem. Okay, next slide, please. Now, what is the clue for the diagnosis of the above condition? One, high degree of suspicion is the key point. Typical history of dengue fever, blood count is suggestive, positive, and negative, and so on. Now, suspicion is more important. This is more important in the country or the place where the disease is prevalent. You must suspect of the above condition. Next slide, please. Now, this is an important point. Concomitant surgery. Surgery may be required, or there may be dengue fever, there may be any surgical condition also. There may be acute appendicitis, cholecystitis, pancreatitis, other surgical condition. Now, during epidemic, until or unless strongly indicated, surgery must be avoided. This is very important. There may be dangerous catastrophe. Even death may occur. I have seen one case that is in around 2000 years. One of my colleagues, he is a doctor, he is an orthopedic surgeon. Actually, he presented at them severe abdominal pain. There was an X-ray abdomen and there was gas shadow on the diaphragm. And the surgery opened, nothing was found. After 1 or 2 days, again severe pain, again X-ray was taken, there was gas shadow on bottom of the diaphragm. And again abdomen was opened, surgery was done, there was nothing. On the third of I have seen that case later on. There was bleeding from every point, surgical wound, there was catheterization, IV fluid, everywhere there was bleeding, ultimately DIC, and he died. He was a doctor. That was the first casualty in our country, being a physician. He was an orthopedic surgeon, he was an assistant professor. So one must be very careful. I have seen cases, it was suspected appendicitis, actually it was dengue fever. And surgeon was ready to operate. I told no, just wait and see. And patient was alright. So everyone must be careful during surgery, especially the surgeon, where there is endemic or epidemic or there is outbreak of dengue fever. Surgery, if possible, must be deferred while there is dengue fever. Next slide, please. Now, investigation, I have given more importance on this investigation. Reason is, patient used to present with fever, and many physicians, for unnecessary reason, they used to do many investigations which are totally unnecessary. In many cases, I do not find, because as a whole, you can waste money also. There are many poor people who cannot pay also more. So unnecessary investigation should be avoided. So what should be done? Blood count, CBC and platelet, this is sufficient. But important is, if the patient presents with fever for 1 or 2 days, better you should not do this. If you do this, count will be normal. If physician or the patient is not aware about dengue, because there may not be any change about CBC and platelet. There will change usually after 4 or 5 days or 6 days like that. So it should not do it. If you've done it at fever, 2 days fever, it will be normal. I may think everything is normal. So again, there will be misdiagnosis. If it is done early, before 5-6 days, normal count will be found. This will misguide the physician regarding the diagnosis if he is not aware. Next slide, please. Now, another investigation. Initially, what you should do, one should do full blood count including platelet and PCB. Some people used to do, once he is thinking it is a case of dengue fever, some people used to do only platelet, but this is not real. At least initially, this should be done. Now there may be a clue here. You can get leukopenia with high lymphocyte and low proliferation, which is a good clue for the diagnosis. Next slide, please. Now another investigation, platelet count. This is the most important and crucial test because it will guide the management of the dengue fever. It is totally unnecessary to do the platelet count every frequently because initially I have said, I am telling before 10, 12 years before, somebody used to do every hour, every 2 hours, 4 hours. It is totally unnecessary. No need at all. It is unnecessary to the platelet count. Another point is, some people used to send to do the platelet in different laboratories. One may be wrong, one may be right, like that, because it will vary also. And this is also totally unnecessary because report will vary from laboratory to laboratory. In one laboratory maybe 10,000, another 20,000, another 50,000. So which one is correct? That is another dilemma. Physician may be in dilemma also. So that is important. No need to send or count in multiple laboratories. No need at all. Next slide, please. Now another important thing. After 2-3 minutes?
3 minutes.
Okay. Dengue antibody, it can be done for the diagnosis. No therapeutic benefit. Same thing also NS1. Again, it should not be done before 5 to 7 days. It will be positive after 5 or 7 days. So if you do it before 5 or 7, it will be negative. Again, this will be a misdiagnosis. It is helpful for the diagnosis, but no management. Next slide, please. Other investigations, these are done routinely, but these are totally unnecessary. Blood sugar should be done because we advise to the patient, take more drink, more sugar, more fruit juice, like that. So if the sugar is really high, so it may be dangerous. These in selective case only, other is no need. Next slide, please. Ultrasonogram, many people used to do ultrasonogram, chest X-ray. It can be done again in selected case, and there you will get ascites in 80-90% case. And when ascites is present, some physician, they try to aspirate. Totally unnecessary. It should not be done because it will be resolved spontaneously. Next slide, please. Same also, chest X-ray, it can be done, and majority of the case, there may be right-sided pleural effusion. Importance is, if there is fluid or pleural effusion, aspiration should not be done unless there is respiratory problem. There is no need because it will dissolve also spontaneously. If it is done, there will be severe bleeding also. Next slide, please. These are other investigations. These are almost majority of the case done by many, but totally unnecessary. Again, you can spend unnecessary money. You should avoid spending unnecessary money because many poor people, they cannot spend. I have seen cases. There is severe headache, MRI or CT was done, totally unnecessary. Next slide. Now, regarding treatment, many people think while treating dengue fever, blood transfusion should be given in every case. Totally unnecessary in majority of the case. If hemoglobin is normal, there is no bleeding, it should be avoided. No need of giving blood transfusion at all. Next slide, please. About platelet, this is another thing. I'm again telling around there 2000, once platelets started to fall, 50,000, 60, 80 like that, everybody used to give, not everybody but anybody, platelet. Again, totally unnecessary. I do not like to give platelet at all. Even 20, I have treated cases, platelet was only 5,000, I have given nothing and patient was fine. So it is not necessarily you will not give, but be careful, unnecessary platelet should be avoided. Next slide please. There are many hazards also. 1 unit of precision requires 4 units of whole blood. So you require for 1 unit, you need 4 person to prepare. So if you get 2 units, you need 8 person, 3 units like that. So it's difficult to get so many people also at that time. So again it is, most of the cases not necessary. So why will be so much worried? Again, another thing is, during platelet transfusion, because this is an emergency, screening for hepatitis B, C or even HIV are usually not done. So I have seen cases, so as an emergency patient platelet was given. And later it was found that patient was suffered from hepatitis B or C, even some cases HIV. So that is more dangerous. Next slide please. So platelet transfusion, again, half-life is only 6 hours. Does not give long-lasting, but no benefit almost. Repeated transfusion may lead to developmental antiplatelet antibody. So platelet transfusion is not required in majority of the cases. Next slide please. Now use of other infusion, this in selective case you can. Next slide please. Use of antibiotics, some people think antibiotic must not be given in dengue fever because it will aggravate, but that is not true. If there is secondary infection, it can be given. Next slide please. Now, this is the last slide actually, I am coming to the last point. Steroid, actually, I want to give some emphasis to the clinician. Somebody is reluctant to use steroid and somebody thinks it should not be given at all. Actually, I have some difference in opinion. It is not true, I think. It is controversial, no doubt. General consensus not to use. But however, in my case, so far, almost I have never given any blood transfusion, no platelet able. In some cases, these are the cases where I use steroid. Severe thrombocytopenia, severe prostration, really the disease is serious. Severe headache, body ache like that. Shock syndrome, multi-organ, liver, spleen, kidney, other like that. And also neurological. These are the cases. This is nowadays it's called the expanded dengue syndrome. These are the cases where the physician can consider giving steroid parenterally. If you give 2, 3, 4 days, I think it is not doing much harm. It is better than giving blood or platelet. Next slide, please. Now I come to the last slide. Conclusion: reassurance is vital, no doubt. Patients, attendant, as well as the physician should not be panicked. It is not a serious disease. I told in the beginning. Should not be very dogmatic in managing the dengue patient. Next slide, please. Dengue is self-limiting disease, no doubt. Even if nothing is done, patient will be all right. However, patient must not be reluctant also. Even the doctors should consult with his doctors. What should be done is very important, no doubt. On the contrary, what should not be done is also important. What should be or may be done must not be overdone. Next slide, please. The idea that blood transfusion or transfusion is essential is futile. So there are some slides, that will take few seconds, just show quickly. Oh, sorry, this is the last slide. Mosquitoes are all around us, so is the suitable environment for their breeding and spread. Eradication of dengue fever might not be possible completely, but it can be controlled up to a certain extent. So dengue fever was present, it is present now, and probably it will be present in future also. It will be continued to be a major threat and challenge in future. What we should not be afraid of it, rather we should live with dengue fever. Next slide, please. Yeah, these are the 1 or 2 slides. Just show quickly. You know the mosquito. These are the places, breeding place for mosquito. They are the world distribution. This is one cases of dengue fever, severe bleeding. Next slide, please. These are the hemorrhage, petechial hemorrhage. Next slide, please. These are the bleeding points. Next slide, please. This is the bleeding, subconjunctival. Next slide, please. See, this is another case of dengue fever. Next slide, please. Anyway, thank you for your attention, your views, comments and questions. Thank you very much.
Thank you very